The patient is a 25-year-old female who worked as a financial advisor. She had a right MCA stroke 2 months ago and had a PEG tube placed. Patient had an MBS done, was diagnosed with pharyngeal phase dysphagia, and is now on pureed and mildly thick liquid trials.
Hi, I'm Megan, and I'll be playing the patient with dysphagia.
And I'm Hannah, and I'll be playing the clinician. Hi, Megan. My name is Hannah. I'll be the primary speech pathologist working with you. After your evaluation last week, I took the time to review your results and the rest of your chart, and I'd like to discuss the results with you today. It's great to meet you.
Hi, yes, it's nice to meet you too. I'm sorry, I am just a tad bit nervous about all this, but I do not really remember the evaluation or what speech therapy is.
It's okay to be nervous. Speech therapy works on everything from the lungs and up. Remember?
Oh, yeah, kinda, I guess. Wait, is there something wrong with my lungs?
No, your lungs are completely fine. I'm here to work on your swallowing with you so we can make sure that food doesn't go in your lungs.
Oh, okay, that sounds bad. So, what were my results? Honestly, I just really want my feeding tube out. Can you remove it?
I can't remove it. I'm sorry. But anyway, I reviewed your modified barium swallow study, and I saw that you silently aspirated and had to be cued to cough and do a throat clear on everything except mildly thick liquids. This means that you have pharyngeal phase dysphagia.
What? Dysphagia? I'm confused. Sorry, my brain has been processing things slower since my stroke.
Oh, that's okay. My brain processes things slowly some days too. Don't worry. Dysphagia is a swallowing disorder caused by impairment in the nervous system or other structures involved with the swallow. The type that you have is pharyngeal phase dysphagia. So when you swallow, the bolus goes into your airway instead of in your esophagus.
Uh, okay, that is a lot. But you are the professional and know what you're talking about. But I want to be able to eat again and get this tube out. I just don't understand why this is happening.
Oh, please don't cry. I promise you'll be okay. A lot of people who have strokes in the area of the brain that you did end up having dysphagia. I'm confident that you'll be able to make a full recovery and get completely back to normal in no time. I would love to help you do that.
Okay, thank goodness. I'm so relieved I'll be able to get back to how I used to be before my stroke.
All right, awesome. So, what we'll typically do in a session will be practicing some strategies that'll help strengthen the muscles needed for swallowing. These strategies are beneficial to decrease the risk of the food and liquid going into your airway. Throughout your time in therapy, I will also be asking you to try swallowing some food and liquids with different consistencies so that we can implement those strategies and see how you do.
What if the food goes down my airway and I am choking when trying the different foods? I don't want to end up back in the hospital.
Oh, no need to worry about that. I'll make sure that doesn't happen. You're safe with me. We do these trials with all of our patients who have dysphagia.
That sounds scary, but as long as you say I'll be safe with you, how will you keep me safe during these sessions?
I would be scared too if I were in your shoes, but again, this is a controlled environment and you're safe to eat while you're with me. There's also a suction machine in the room for me to use if it's needed, and the techniques that I'm going to teach you will help you learn how to swallow safely.
Okay, that makes me feel a little bit better. You are the professional.
Okay, good. So now I made some goals for you, and we're going to get started on teaching you those swallowing strategies. Okay, any questions before we begin?
Yeah, I do have a question. What are the goals? The main thing I want to work on with you is getting my feeding tube out so I can feel normal again and do the things that I love.
All right, yeah, we can discuss that later. But for now, let's work on the goals that I created for you. I know this whole discussion was a lot, but I'm really glad you were able to keep up. If you have any questions, just feel free to ask me at the end of our session. Do you have any more questions right now?
No questions, I guess. I am ready to start.
Hi, Megan. My name is Hannah. I'll be the primary speech pathologist working with you. After your evaluation last week, I took the time to review your results and the rest of your chart, and I'd like to discuss the results with you today. It's great to meet you.
Hi, yes, it's nice to meet you too. I'm sorry, I am just nervous about all this because I do not really remember the evaluation or what speech therapy is.
Oh, it's okay to be nervous. I'm here for you and to help you achieve your goals in speech therapy. The best way to describe speech therapy is that we work on everything from the lungs up. This involves our swallowing, our memory, thinking skills, and our speech and language.
That makes sense then. Thank you so much for explaining how you'll be helping me. What are the results of my evaluation? I just really want my feeding tube out. Can you remove it?
Yeah, I want you to please stop at any time if you have any questions or if anything doesn't make sense to you while I'm going through your results. I unfortunately cannot take out your feeding tube, but throughout our sessions, we're going to work on getting you back to a normal diet so that we can work toward that goal together. I think it's great that you feel so motivated to get your feeding tube out. It'll be really helpful for your success in therapy.
Thank you so much. I appreciate that because I know I will have questions as we move forward. So, what were my results?
Well, to start, have you ever heard of dysphagia?
No. What is that?
It sounds like a weird word, but all that dysphagia really means is difficulty with swallowing. In our throat, we have our esophagus and our trachea. Have you ever heard the saying, my food went down the wrong pipe?
Yeah, I've heard that term before.
So the pipes are your esophagus and your trachea. Your trachea is the airway that leads to your lungs, and your esophagus is for to your stomach. So when we feel food going down the wrong pipe, that's a sign that our body is reacting to food going toward our airway. So it's a good sign when we feel that because then we can try to cough it out. But after I reviewed your live swallow study, it showed that when you swallowed the thinner consistencies, they tended to go down the wrong pipe and into your airway. Does that make sense?
That makes a lot of sense. Thank you for breaking that down for me. My brain has been processing things slower since my stroke, and it's really frustrating.
Yeah, it sounds like you're feeling frustrated about your health and what your life might look like after your stroke. That's a completely understandable way to feel after what you've been through. I'm really sorry that you're going through this. It must be very difficult. I can't even begin to imagine how it feels.
Yeah, exactly. I just don't know why this happened.
Take a deep breath for me. We're going to work on this together. Dysphagia is very common in patients who've had a stroke. Unfortunately, so much of our life is out of our control, and we can't always prevent strokes from happening. But what we can do is make the most of your strengths, and we can use them to move forward and cope. And I would love to help you do that.
That sounds great. Thank you.
All right, awesome. So, what we'll typically do in a session, we'll be practicing some strategies that'll help strengthen the muscles needed for swallowing. These strategies are beneficial to help decrease the risk of the food and liquid going into your airway. Throughout your time in therapy, I'll also be asking you to try swallowing some food and liquids with different consistencies so we can implement those strategies that you've learned and see how you do.
What if the food goes down my airway and end up choking when I try the different foods? I don't want to end up back in the hospital.
Yeah, it must be scary to think about trying different foods again when you have difficulty swallowing. It's completely valid to feel that way. Is there anything that I can do to make you feel more comfortable with trialing the food and liquids?
No, not really. I think it's just my nerves getting to me. How will you keep me safe during these sessions?
So this is a controlled environment and you're completely safe to eat while you're here with me. There's a suction machine in the room for me to use if needed, and the techniques that I'm going to teach you will help you learn how to swallow safely.
Okay, that makes me feel a little better.
Before we get started, I want you to know that you're always free to express yourself with me. I wanted to ask you what your goals are for yourself throughout all this because your opinion really matters to me.
Thank you so much for understanding what I'm going through. The main thing I want to work on with you is getting my feeding tube out so I can feel normal again and do the things that I love.
All right, we're definitely going to work toward that together. I'm also going to give you a typed up summary of everything that we discussed today, including what dysphagia is, the type you have, and our diet recommendations for you. Do you have any questions for me before I start teaching you some swallowing strategies?
No, I don't have any questions right now. I appreciate that you will have a summary of everything for me. I am ready to start.